Daytime sleepiness linked to increased Alzheimer's risk. Sleep disturbances in patients diagnosed with Alzheimer's disease is well known. A new study from Johns Hopkins reports daytime sleepiness may increase the risk of developing Alzheimer's disease. Analysis of data captured during a long-term study of aging adults shows that those who report being very sleepy during the day were nearly 3 times more likely to have brain deposits of beta-amyloid, a protein that's a hallmark for Alzheimer's disease, years later. The finding, published in the journal Sleep, on September 5, 2018, adds to a growing body of evidence that poor quality sleep could encourage this form of dementia to develop, suggesting that getting adequate nighttime sleep could be a way to help prevent Alzheimer's disease. Adam P. Spira, Associate Professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health, is the lead author of the study. Factors like diet, exercise and cognitive activity have been widely recognized as important potential targets for Alzheimer's disease prevention, but sleep hasn't quite risen to that status. The study used data from the Baltimore Longitudinal Study of Aging, BLSA, a long-term study started by the NIA in 1958 that followed the health of thousands of volunteers as they age. Analysis of this data showed a correlation between daytime sleepiness or napping and beta-amyloid deposition in their brains. After adjusting for demographic factors, the risk was 2.75 times higher in those with daytime sleepiness. Why daytime sleepiness would be correlated with the deposition of beta-amyloid protein is currently unclear. One possibility is that daytime sleepiness itself might somehow cause beta-amyloid protein to form in the brain. Based on previous research, a more likely explanation is that disturbed sleep are due to obstructive sleep apnea, or insufficient sleep due to other factors, causes beta-amyloid plaques to form through a currently unknown mechanism, and that these sleep disturbances also cause excessive daytime sleepiness. However, it is not possible to rule out that amyloid plaques that were present at the time of sleep assessment caused the sleepiness. Animal studies in Alzheimer's disease models have shown that restricting nighttime sleep can lead to more beta-amyloid protein in the brain and spinal fluid. A handful of human studies have linked poor sleep with greater measures of beta-amyloid in neuronal tissue. Growing beta-amyloid plaques and related brain changes are thought to negatively affect sleep. This study adds to growing evidence that poor sleep might actually contribute to Alzheimer's disease development. This suggests that sleep quality could be a risk factor that's modifiable by targeting disorders that affect sleep, such as obstructive sleep apnea and insomnia, as well as social and individual level factors, such as sleep loss due to work or binge-watching TV shows. There is no cure yet for Alzheimer's disease, so we have to do our best to prevent it. Even if a cure is developed, prevention strategies should be emphasized. Prioritizing sleep may be one way to help to prevent or perhaps slow down Alzheimer's disease. Thank you.